Thank you so much for joining us this evening for the 6th in our menopause series of Restless Presents with our partners, My Menopause Centre. On this occasion, we're looking at the menopause in colour, time for an inclusive conversation. Before I hand over to Helen, who will chair this evening's event, I wanted to remind you of a couple of housekeeping points. Please post your questions and thoughts in the chat function at the bottom of your screens, and feel free to post throughout the presentation. There'll also be time for questions at the end. This event is recorded and will be mailed to everyone who registered this evening, along with lots of links to other resources. It will also be available to view on our YouTube channel, as well as within the menopause section of Restless. I'd like to hand over now to our panel chair, Helen Normoyle, who is co-founder of My Menopause Centre. Helen has held Chief Marketing Officer roles across the healthcare, beauty, broadcast, furniture and property sectors, and is a self-described women's wellness champion. Over to you, Helen.
Thank you so much, Mel, and good evening, everyone. Now, as you'll have seen in the webinar invite, despite the increasing coverage of menopause across the media, too many women are still suffering in silence while their symptoms impact all aspects of their lives, from relationships to home to work. So even though the menopause is something that every woman will experience, there is still a lack of awareness of the menopause transition, symptoms and treatment options, and in particular for women of colour. Knowledge is really empowering, and we know that the more prepared we are for the menopause, the better our experience of it will be. And that's why I'm delighted to be joined this evening by two brilliant doctors that I have the honour and the pleasure of working with, Dr. Tonye Wokoma and Dr. Manisha Singh. And this evening, they'll both share their first-hand experience and expertise in all things menopause. Dr. Tanya is an experienced consultant in sexual and reproductive health and community gynecology, and has been a British Menopause recognised menopause specialist for almost 10 years. Dr. Manisha Singh is a consultant in sexual and reproductive health and community gynecology with over 13 years of experience as the lead clinician and NHS consultant. Both Dr. Tanya and Dr. Manisha work in the NHS and My Menopause Centre, and it's brilliant to have you both here. So one other thing I should say before we start, I hope as all of our audience can appreciate, we can't provide any personal medical advice within the session, but we can of course comment on general questions, and we do hope that you'll pop them into the chat. So let's get started with the first question for you, Tanya. We hear a lot about perimenopause, menopause, postmenopause, menopause transition. Can you summarize for all of us just what this means?
Thank you, Helen. Thanks for the introduction. So the menopause, very, very briefly, is when a woman's period stops. And there's a time that leads up to it, around the time of the menopause, that's called the perimenopause. That can go on for between 5 to 10 years, often after the age of 40. And this is when women begin to experience symptoms because of fluctuation in their hormones in the background. The postmenopause is after a woman has gone through the menopause. And it's important because we will spend 1/3 of our lifetimes, most of us, in the postmenopause. So it's important that we try to be as healthy as possible leading up to this time. But the other thing I'd like to mention as well, Helen, is premature ovarian insufficiency, because I don't think that's picked up enough. That's the time when a woman goes through the menopause before the age of 40. It's very, very important because it often, if untreated, can lead to adverse health outcomes. So it's really important. It's strongly recommended that the woman does get estrogen replacement if that is appropriate because of the effect on her bones and on her heart. Menopause, for most women in the UK, the average age is about 51, but it can be from the age of 45 to 55. That's recognized as being normal if you go through the menopause at that time. And all this is called the menopause transition or the climacteric, and it comes along with lots of symptoms, which I'm sure we'll talk about, and that's why it's important.
Yeah, so really interesting, Tanya. So there's the perimenopause, menopause, postmenopause. Happens mid-40s to mid-50s, and I know that comes as a surprise to many people. It's much younger than they think. But in your experience, or based on what you're seeing in the data, is there any difference by different ethnic communities in the age at which the menopause happens or the perimenopause starts?
Like we've mentioned, the average age is about 51 in the UK, but there are some studies from other countries that suggest that women from other ethnic groups, so Black African, African American, may go through the menopause a few years earlier, but it is usually still within this range that's considered as normal. So between the ages of 45 to 55, like you've mentioned, there needs to be more studies to see whether there is actual true differences in the age at which a woman goes through the menopause. I think in our communities where we come from, perhaps we don't talk about it enough. We need more studies from those communities to ask all these questions.
So could it be okay to conclude from that there might be some differences in 1 or 2 years of age, but in generally it's something that will happen mid 40s to mid 50s?
Yes.
Okay, brilliant. And then Manisha, we know that menopause is a taboo around the world, anywhere, any country in the UK. But in your experience, your clinical experience and your personal experience, does the taboo vary in different ethnic communities?
Thanks, Helen. I would definitely say, though it is a taboo, it is still a stigma among all women, but it is particularly so among ethnic minority, and I'm also talking in particular reference to South Asian women. We grow up not being encouraged to talk about periods, to talk about sex, to talk about relationship. So you're not you don't grow up with the skills to talk and express yourself about that whole section, which is a very important part of you. Often periods are looked at as not a good time of the month. Sometimes you're not allowed to pray during that time in a lot of cultures. So it is and you see your moms and your aunts and your older sisters going through menopause without actually ever complaining about it. And then you take it on yourself that actually you have to it is a part of your life and you have to, sort of put up with it. It is not thought to be, I think, of a medical condition which can be helped with or treated. And I think the lack of awareness and the lack of sort of normal conversation going around it is not helping. So we need to increase and normalize those conversations. Often, as Tanya mentioned about premature menopause, and often a woman's status, and I'm not it is not for everyone, but some women, it can be linked to, the status can be linked to your ability to bear children. And when you sort of lose that, you go through menopause, particularly for the younger women, then it is a huge stigma. It is must be a huge place of anxiety, because it can lead to a lot of sort of power changes within the family. Your husband may be encouraged to marry again, or, may lead to a divorce. So it can be catastrophic for some section and for some women in some cultures. So yes, and as I was just mentioning earlier, is that we struggle. I mean, I would struggle to talk about sex openly, because it is something which we haven't done. And it takes time to sort of for you to get out of your culture, which something you've grown up with. So yes, but it is about doing it again and again till you get comfortable with it. And for us to make a support system around us and find a safe space where you can talk to, women, your partner around about it.
Yeah, and Dr. Manisha, as I said when you mentioned this earlier, it's absolutely fantastic that you've come on the video webinar tonight, even though you're not comfortable talking about this or talking about sex in public, but to do this, and I really appreciate it, because you will enable so many other women to start the conversations and go, I'm out of my comfort zone, but this is too important to not talk about it.
Absolutely.
Because you must be seeing, how do you see the ramifications of not having the conversation play out in your community or with South Asian women? And Tanya, I'll come to you in a moment to talk about your experience of this, you know, with British, African, Black Caribbean communities as well. But what are the implications of allowing the taboos to stand?
The implications are, first and foremost, that women just are not coming forward to get help. One is they don't realize that they need help, that help can make them feel so much better. Then there's the whole stigma around it, is that one is they're acknowledging that they can't cope with something. So they are acknowledging that they need help for something they've seen their mums and all just live through, and they have been told possibly breathe through it. So they feel exceptional rather than a part of the whole norm that they need help. Again, I was thinking through, and I was thinking that I haven't seen many Asian women or Black African women who've come with pure menopausal symptoms. Like the commonest we know is hot flushes, night sweats. They will come to us with a different array of symptoms, and then you have to tease out that actually you have to make them understand that actually it is all linked to menopause. You're feeling low, or you're having urinary problems and you need to rush to the toilet, or you can't hold your urine. It can be linked to menopause. So yes, I will let Tonya add to it. And
No, I agree completely, Manisha. We don't see often many Black women or Asian women in the menopause clinic. They may be picked up in other clinics for various other reasons, but we don't see them coming forward. And it's back to what Helen was saying about it being a taboo subject. I think people are talking about it more now in all communities, but there is still that culture of silence, isn't there? We didn't hear our mothers speak about it, or if we did, it was something that was laughed at, and it wasn't recognized. The symptoms weren't recognized as something, as you've said, where you could see somebody and get help for it. And of course, this then, perpetuates this culture of silence where it's not discussed, and myths and misunderstandings. Then they propagate, they flourish, they grow, and of course that leads to women, which is what we see, not using the most effective method of treatment for the menopause, or perhaps even at all. I think it's getting better, but there is still quite the huge culture of silence around the menopause. And it starts, as Manisha said, with periods, not coming forward for help with periods, and then it just goes on and on until women get to the menopause.
Yeah, there's an embarrassment, isn't it? There's shame. There's a lot of feelings you deal with before you reach the point and you access help. And apart from actually getting comfortable and talking about it more till the point that you're you build yourself, your confidence.
Yeah.
That is what we can support them, or support women with.
So I think, look, from everything you said, it's really clear that we have to change this. There are just too many women who are suffering. They're falling out of life because of symptoms that can be treated. They're either not aware of them, they're too embarrassed to talk about them, and they're not getting the right support. So may this be the first of many such events that we do, because it sounds like, as you both are doing tonight, the way to smash the taboo and normalize the conversation is to have the conversation, and we just have to keep plugging away. And I have no doubt that you will inspire more women to come forward and to talk and to get comfortable, I suppose, at being uncomfortable. Now, we've touched on some of the symptoms, and Manisha, you spoke about the embarrassment around vaginal symptoms, bladder symptoms, incontinence. Could you just give us maybe a quick overview of the main menopause symptoms?
It is varied, and it is several odd symptoms. So many symptoms come, and that's what I think also makes it difficult for women to acknowledge that or understand that this could be related. So we've already mentioned hot flushes, night sweat, which is the classical menopause symptoms, which most women are aware of. It will happen in about 70% of women, at least, who go through menopause. And it, like Tonya said, the perimenopause lasts for a long time. So actually women can have these symptoms for a long time. And some women are, unfortunately, will have the symptoms well into their 60s. The other symptoms, the one which I think, again, is not well related to menopause is sleep disturbance. And I think it has a huge impact in every way on a woman's life, because that impacts on your ability to function, to work. Then comes the psychological, the whole women get struck by feeling moody, anxious, overthinking, rethinking their decisions, just small decisions, what I want to wear, what I can't, things which didn't need a thought before. Brain fog, memory loss, recalling why you went to a room. I can forget a patient's name just walking down the corridor from my clinic room to the reception, that kind of thing. And again, I touched on what we now call as the genitourinary syndrome, is that the vaginal dryness, the discomfort during sex, painful sex, urinary symptoms, going to the loo more often, not able to hold urine, to get incontinent, dry eyes, dry skin, itchy skin, hair loss, there's such a myriad of symptoms. And I know I would have still missed many, but there are, many, many symptoms. And yeah.
I suppose it's looking at them holistically. So Tanya, please.
Yes, no, what I was going to say is that the other thing about women from ethnic minorities is that they would possibly often describe these symptoms with different terminology. So what I've heard from Black African women is they suffer with internal heat. They have a pressure in their heads. They have things crawling all over their bodies. And when you think about it, or if they mention these things in isolation, they don't relate it to the menopause. And again, is what they think can be done about it. And perhaps that's one of the reasons why they don't come forward for help. They do want help. It's not as if women don't want help. Is where do they go for help? How do they access help? That's the issue. So the first thing is the recognition, and then of course describing it in terminology that perhaps other people might understand as well. I don't know if that's the case, Manisha.
Yeah, absolutely. And now I think is that previously I would have, this thing exactly similar description happens in Hindi and Urdu as well, is that, suddenly feeling of pressure and heat rising from the abdomen going straight to the head. And you think that one is, they don't realize it's menopause. And the clinician who's seeing them doesn't realize, because the way of expressing it is so different because of the cultural nuances. So yes, it is very similar descriptions. And because there's no word for it, let's say the language, there's no word, I don't think, for menopause or hot flushes or night sweats in Hindi, possibly not in Urdu as well. And so then women have to find descriptions and to describe it, and which is often not understood by the clinician as well.
So I think to maybe help with this, I've just put a link into the chat to a symptoms overview and a simple explanation of the menopause on the website. And Emma, our brilliant social media manager who's on hand, Emma, if you could maybe put some links in, so hopefully people might find that information in there about the symptoms and how to describe them, and also maybe the link to our menopause questionnaire, because that can help you identify the symptoms that you have. And it's all free, and you get a personalized email and you can take it to your doctor. So hopefully, if people are finding it challenging to express themselves in a way that their doctor understands, I hope this resource will help them. Now, you've done an amazingly brilliant job. I can't think of anything that you haven't covered, Manisha, in there on all of the symptoms. And that can sound quite daunting, can't it, when you hear all those symptoms together? But there are a range of ways to treat these symptoms, aren't there? So shall we start with maybe talking about some of the solutions and things that women can do to take control and manage their symptoms?
Yes, no, absolutely. There's different ways to treat the symptoms. Now, we know from the little data that's available that women are suspicious, should we say, maybe even averse to using hormone replacement therapy. But that's not the only treatment available. We'd just like to point out that lifestyle changes has a massive impact. So exercise, diet, in my community, the diet is very, highly carbohydrate laden. And so that's something that could be looked at, because of course, all these things can impact on the symptoms that women experience. Having a positive attitude, for any woman, because the menopause comes with a lot of negative connotations to it. But actually, in some cultures, it's something to be celebrated. So it's having that positive attitude and wanting to get the best out of this period in time for the woman is often helpful. It will help them seek help, access help. And there's other treatments apart from using hormones that, we can use to treat women who go through the menopause as well. So I think there's various ways. I think in my community, what I find is that women would prefer to use herbal or natural remedies. They'd prefer, to avoid using hormones if possible. And that's fine. It's just to mention that, of course, women need to be careful about using herbal remedies to make sure they're safe, make sure there's no interaction with whatever medication they're on. And there's lots of things that they can do to help themselves as well.
Dr. Manisha, what are your thoughts? And we'll come back to HRT in a moment, and we have several questions about HRT in here, which we can weave in to this part of the discussion too.
Yeah, I think there's some such quick wins that you almost feel, it really makes you, sad that women don't have access to that. So there's a lot of symptoms like, say, vaginal dryness or urinary symptoms, which we've discussed before, which can be very easily and very safely treated with vaginal estrogen, which comes in different forms. It comes as pessaries, it comes as ring, which can be left in for 3 months. It comes as creams, and that gives you, I often tell patients that there is no sort of quick cure or miracle, but actually these symptoms are almost very, very quickly cured, and it can be maintained for a long time very safely. And if one is really wary of hormones, even vaginally, then there are actually non-hormonal vaginal moisturizers and lubricants. But there's some really quick wins. And I can't overemphasize, like Tonya said, about, exercise and lifestyle, because they have a huge impact as well. And I think this is the time when we need our girlfriends and do group exercise and group diets and, and the build that support and build that safe space for those conversations, which you can have with your close friends and do things together. And that can be very uplifting in itself. And yes, and there is definitely, as Tony said, there's definitely a role for HRT, and because the menopause symptoms are because of the decline in estrogen. And there is the wariness, but actually the benefits of long-term estrogen, especially for premature menopause, is huge. It is, life-changing benefits of cardiovascular protection and bone protection. So, and the symptom relief.
So maybe while we're on this then, because I'm sure there are a lot of people that are going, they've heard of HRT, they know it's hormone replacement, but what actually does HRT do?
So HRT is there's different types of HRT. And usually HRT is made up of estrogen and progestogen. The estrogen is usually what our bodies are wanting back. It's because of the decline in estrogen that women begin to experience symptoms. And the progestogen is there, or progesterone is there, to protect the lining of the womb if a woman has a womb. So if she's had a hysterectomy, for example, then she would get estrogen only HRT if she does want HRT. And then the other thing to mention as well is more often now we are offering women testosterone replacement, which the ovaries produce a small amount of, and that can be helpful for libido and energy as well. There is some evidence for that. But back to, the thing with all this is that it's finding that supportive clinician to have a full discussion with, who will, assess your medical, history, find out what has gone on in your family as well. And they'd be able to support you to have the right treatment for you at that time.
Like
and then,
Tonye
of course,
said,
there's vaginal estrogens, as Manisha's mentioned already.
yeah, as Tonye said, that supportive clinician who can actually tailor the care for the individual, while it is quite, it is a standard treatment, but still it is a bit of individual care, personalized sort of treatment for every person, because it still varies. Some symptoms are better treated by, a particular way. So
yeah, and I wonder sometimes with the resistance to HRT, and I know certainly speaking for myself, initially I wondered if taking HRT was a sign of failure on my part, a sign of being weak and just not strong enough to cope with the symptoms. And a couple of months of the symptoms made me think, sod it, I'm taking it. so, but I wonder if there are other women who might think like that it's a failing on their part, when actually, as I've learned so much from you and from Dr. Claire, I'm just replacing the estrogen that I've lost in my body to smooth the peaks and troughs to manage the symptoms. And I think most of the estrogen that's prescribed nowadays is what's called body identical. So it's not synthetic, so it's natural. So do you have any thoughts or observations on that, maybe as a reason for why women aren't as comfortable maybe taking HRT?
I mean, it is a normal part of aging. We must say menopause is a normal part of aging. And so because of that, again, of course, more so in some cultures, it's regarded as something where you just have to put up with it. You just have to grin and bear it and go through it. Now, we know that on average, symptoms can last up to 8 years. That's a very long time in a woman's life when she's looking after parents, looking after children, working, doing all sorts of things. And for some women, it never goes away. And there are a lucky few who perhaps don't have significant symptoms that's impacting on their lives at all. So again, sometimes in our communities, and this is possibly anecdotal, women are seen as very, very stoic. They're very strong. They just get on with it. They don't talk about it. It's normal, it's natural. Our mothers didn't need any medication. Why do we have to take medication? And then, of course, in addition to that, people are frightened by the side effects of hormones, which we have to say needs to be put into perspective, because we Manisha and I would always explain what the risks and benefits are, and tailor the treatment to the particular woman. But there are benefits to using hormones as well, long-term benefits, which I think often people forget to mention, forget to talk about, in addition to being, to treating the symptoms. I think my sister described it as she said, oh, it was like I was wearing a dirty pair of glasses. And then when I said, look, you must go and get HRT. And again, she's a doctor as well. You must go to your doctor and go and get HRT. She says, oh my goodness, it's like having on a clean pair of glasses now. Things are just so much clearer. So there are benefits to having the hormones, and it needs to be tailored, and it needs to, you need to have a good assessment, a good discussion with someone who's supportive.
And we see the other side, Tonya, isn't it? We see the miraculous relief which women get, and we hear them, and it is so rewarding when they come back and say that, you know, my life has changed. You've changed my life. And we know it is not too complex, a treatment which we are giving. So we see that side much more and then that makes you think that it really needs to, the word needs to get out, and women need to be aware that it may not work for everyone, but it is definitely worth trying if you are sort of, you know, if you have symptoms. It is worth giving, you know, safely giving it, taking all your, you know, medical history into account, safely giving, because we see the other side where women, you know, they say, you've saved my marriage, you've saved my life, you know, we see that side. So we would want more women to come out with their symptoms and come and talk to us, people like us.
Ask for help, isn't it? Don't be afraid to ask for help. The
No,
help is there.
I think you're more strong and you're more brave when you come to ask for help rather than accepting defeat, because it is harder to acknowledge your own, you know, and then go and ask for help.
Yeah, and it's so important. I'm going to come to, we've a load of questions for you guys. It'll be a bit like Mastermind. I'll be throwing all these questions at both of you now so we can get as many answered before we finish. But Tanya, you mentioned earlier about how much of our life we're now living postmenopausal. And there's a great little table in the ONS website, and you can see, you know, average life expectancy and how long you can expect to live. So we, healthy women in our 50s, can expect to live to be 89. So what that means is that we're going to spend about 38 years of our lives postmenopausal. That's over 40%. You're way too young to give up, aren't you? And to kind of go, I'll suck it up and I'll live with it for the next 38 years. I don't think so. So please, you know, don't be afraid to ask for help. Now, lots and lots of questions about symptoms, about HRT, and about how do you know if you're menopausal. So I'll kind of start at the beginning of the journey. Question in here around, will blood tests help me understand if I am menopausal?
In the perimenopause, the blood tests often will be normal, and the recommendation is not to have a blood test. We go by symptoms, so we treat the woman based on the symptoms that she's getting, and we adjust her treatment, you know, based on the relief that she gets with the treatment that she's received. So blood tests can be used when it's used appropriately. For most people, they don't need a blood test to make a diagnosis of the menopause because we will go on symptoms.
Brilliant. So because there's a lot of stuff out there now to buy, isn't it? So really just check to make sure that it's going to be of use. And then Emma, would you mind putting in a link to the menopause questionnaire, because we have a question in here, and how can I find the menopause questionnaire, which can help. Now we've got some questions in here on symptoms, and then we have an awful lot on HRT. So Tanya, there was a question in here about fibroids. I never know if I'm pronouncing it correctly. It's my Irish accent. Fibroids or fibroids, and their prevalence in Black communities. So do you have any kind of thoughts on that, and how that might impact women and might impact the treatments that they can take?
So Black and Asian women are known to have fibroids or worse fibroids. Fibroids are, unfortunately, they're very common. Uterine symptom, and they can lead to symptoms, heavy bleeding, pain, those sorts of things, pressure symptoms in the abdomen. Women who have fibroids can have HRT. HRT can, fibroids, when women go through the menopause, the fibroids can sometimes shrink, depends on the size of the fibroids, and sometimes they can actually grow very big and they might have to be removed. But women, the short answer is women with fibroids can have HRT. The fear is sometimes that women the HRT, replacing the hormones, will stimulate the growth of the fibroids, but it doesn't, in most women, it will not significantly increase the size of that fibroid to the point where it's causing symptoms, unless it was causing problems possibly before. So again, it just needs to be individualized, but women with fibroids can have HRT.
Thank you very much for that. I've just seen a comment from Emma. I'm not sure if people can see the chat. So what we'll do is in the email that we'll send out with the video, we will send out the link to the questionnaire. And I'm not sure if we can put it in the Q&A section. So apologies for that. So some other really great questions. So please keep the questions coming in. If we start with maybe some of the questions. So if you're taking HRT, if we still stay on the transition, how do you know if you're postmenopausal if you're taking HRT?
Again, it is symptom relief, and you may not know when you're postmenopausal because you're in HRT, I guess, because of your symptoms. So, and it really doesn't matter if you don't know. Again, like Tonye said, we wouldn't actually do a blood test because it may not give you the right result anyway. So sometimes you wouldn't know if you're an HRT or you have been on a form of contraception which has stopped your periods. We go by the symptoms.
Brilliant. That's really helpful. That's really clear. And then can HRT, maybe if you take this one, Tanya, can HRT bring about vaginal bleeding even in someone who has stopped their periods?
Sometimes, yes. If you're replacing hormones in somebody who's stopped their periods, we usually advise women that they may get some bleeding in the first few months. Now, if a woman is less than 12 months from her last period, we would offer HRT that would bring back a monthly bleed. And there's reasons why we do that. So you have to be at least 12 months from your last period before we give you a preparation where you don't get any bleeding at all. But when starting any hormones in the first 3 to 6 months, you may have some spotting if you're completely postmenopausal, which I would expect to settle down.
Thank you. Very, very clear. And then Manisha, I'll put this question to you. Again, a really great question. Do we think that the nervousness about using HRT is because of trust or the previous negative press about HRT, 10, 20 years ago?
Yes, absolutely. I think it takes time for the trust to build up. There was so much negative press about breast cancer and HRT and clots and HRT. And, studies have shown that actually the risk of getting blood clots is no more using the right kind and the right route of HRT. And with breast cancer, there are other risks which actually of lifestyle, which have a higher risk than estrogen, like the body mass index, the weight, the weight of the patient, having wine and alcohol increases the risks possibly far more than HRT does. And again, it is the route and the type of HRT, which again makes a difference. So yes, it is the nervousness because of the legacy of bad press, which HRT has got, which women are sort of scared to trust again. And I think sometimes the hormones of the HRT, because they are estrogen and progestogen, can be sort of confused with hormones of the contraceptive pill, which is again estrogen and progestogen, but they're different types. So the ones in HRT are much more of the natural body hormones.
Thank you, Manisha. I think it just calls out the importance of speaking to your doctor to get the facts. And I think we've got the chat working. I'm hoping it looks like it is. So we've put in some links, and Emma, maybe we can put in some more of the links now to that. And a really great question here while we're on the topic of trust. Many BAME women do not trust the NHS government, as we have seen with the take-up of the COVID vaccine. How do we start to change the dial on this and support these communities to trust the NHS?
Yeah, it's I think Manisha mentioned it. It's about continuing to have that conversation, because we can't say, oh, women aren't trustful, which they're not. There is the issue of trust. I agree completely. But I think it's about representation. I think it's about building confidence. I think it's about raising awareness. I think it's about talking women from within communities, talking to women within that community, because those are the people that they would trust as well. I think it's about women coming out and saying, this is affecting me in this way. So so people like Manisha and I can support all that. You know, my menopause center supports things like that. It is about talking, continuing to talk to women, essentially, to build that trust. Thank
you. And then this is a really great question and quite topical as well. So is there a link? So thank you for the questions, everybody. Is there a link between the lack of estrogen hormones and dementia?
There's many studies. There's different studies now on if there is a link. We do know that the women experience cognitive dysfunction in the menopause, you know, as Manisha was saying, walking down the corridor and forgetting what name you intended to call. There is no, at the minute, the NICE guidelines say there is no link between lack of estrogen and dementia, but there will be, I'm sure, many more studies that will, you know, we'll wait to see many more studies that will come out about it.
Isn't it? To, yeah.
Yeah, so good to kind of get the facts on that, and I think, as you say, the BMS has come out with some very clear guidance on that as well. So sticking to hormones, what are your thoughts on testosterone, and what does it mean that it's prescribed off license? Because it's quite variable, isn't it, around England, in terms of willingness, I suppose, to prescribe it or entertain it.
It has come much more in focus, isn't it, recently? And I think we all, and the BMS says that there is a role for testosterone for sort of loss of libido, desire, but there is no great evidence about, the other bits of menopause. But there is a definite role for, which can be debilitating symptom, which can lead to, which is the loss of, libido. And it is, I think the demand for it has gone, and the demand for it has really gone up in the last couple of years. But there is no great evidence about the, because women also suffer from lack of energy, tiredness, not feeling. Women describe that loss of mojo when they go through the menopause. There's no great evidence. I don't know what Tanya will say about the other bits for.
No, I absolutely. There is a role for testosterone, but it again has to be put into context. So it needs to be appropriate for that woman. The thing with HRT and the symptoms of the menopause is that the symptoms overlap with so many other things. And if life is stressful even, that can sometimes contribute and negatively impact on the symptoms of the menopause. So there is a role for testosterone. It needs to be done correctly or appropriately, should I say. We need to monitor testosterone levels with blood tests. So coming back to the off-licensed statement that we usually say, it means that the testosterone we use in the UK was not designed to be used by women. We do use what they give to men, but we use it much more cautiously, and we use it much more, appropriately for women, but we then have to measure and monitor blood tests in women. It's not for everyone. It's not effective for everyone. And so it's worth a trial if a woman is experiencing the symptoms, as Manisha has said, lack of libido, lack of energy, but it may not be for everybody. And sometimes it can have side effects as well.
And the other thing, we usually first give the sort of the standard HRT, estrogen and progesterone if needed, because sometimes that is enough to deal with the symptoms before moving on to testosterone.
Thank you for that. Now we have a couple of questions in here from people who are saying they're just not getting the support they need from their GP. So one lady who said she's asked her GP for HRT to help her with her symptoms. But her GP just keeps telling her no, she doesn't need it. And another who's saying she's just not feeling supported and she's in pain and she feels like she's burning. obviously really bad hot flushes. So what advice can you give these women who are unfortunately just not getting the help that they need? What would your tips and advice be?
I mean, so the first thing is, if they've been to see, a doctor or a nurse or whoever, and they feel they're not being supported, is to ask to see somebody else. But before they go to see, a clinician, before they approach their GP, if again, they go back to this questionnaire on the My Menopause Center, where they can, tick the different symptoms that they may be experiencing, which may support the reason why they think it might be a menopause problem, and also sort of monitor their symptoms over time as well, just to see what the trend is. With menopause symptoms, often they will persist, and therefore you can say, oh, I have this, I have that, I've looked into this, I've tried this. Over time, it's still there. And is there anything that can be done? It's much more powerful if you've got, if there is the data, should I say. And I feel sorry for women, because it shouldn't be on women to have to fight to get the treatment that they deserve. But this is one way that they can get what they want. They can be empowered to get what they need by sort of keeping a diary and ticking off their symptoms on a symptom checker, and discussing it with their doctor in that way.
Yeah. And having the confidence and to say that actually you've tried all those things which were suggested, but actually you've read about it and you've spoken to friends who feel much better being on HRT. And if they couldn't, then they refer you to someone who can.
Yeah, exactly. And I think, as we said, really take the questionnaire and bring the results in. It's all evidence-based, written by doctors who work in the NHS, work privately. So no woo-woo in there. A very interesting question here. Can tingling in the foot plus joint pain be part of the menopause?
Yes, is the short answer. Yeah, so these are the symptoms that, again, you don't realize they're not recognized as menopause symptoms, and people suffer with it, and it creeps up. It's very gradual.
Yeah, I mean, joint pains and muscle pains is one of the very common symptoms which we are seeing with menopause. It's quite common.
Yeah, I've just put a link in, hopefully everybody can see it, into the symptom checker, where joint pain is one of the 38 to 40 symptoms that we cover in alphabetical order. Last couple of questions on HRT, and then we'll take some general cultural ones, and then I'll hand back to Mel and we'll wrap up. This is a really good question and so important. What are the guidelines about taking HRT when you're older?
So in the past, we used to sort of restrict the use of HRT. We used to say women could only use it for a few years and then they'd have to stop or come off it. And we don't say that anymore. There isn't any arbitrary time limit to the use of HRT. Now, again, if a woman is older and she needs or wants HRT for the symptoms that she's experiencing, it's back to what we were saying of having a proper discussion with somebody who is trained and knowledgeable and able to do a proper risk assessment and come to a decision together as to what would be right for the person. But yes, the short answer is older women can have HRT, but it just needs to be done appropriately.
Yeah, and really important when you think you might have another 30, 40 years ahead of you as well. So well worth the investment in asking, and maybe being slightly awkward with your doctor if you're not getting the answer you need. So last question then on HRT. A very interesting comment from somebody here saying, really pleased to see that Gina is available over the counter, but shocked to see the cost of £29.99 a month. Isn't this exploiting women and minimizing the amount of people who can afford it, especially in the current economic climate? So to clarify, you can get Gina on an NHS prescription as well.
Yeah.
Yeah. Yeah, so if very understandably, it's unaffordable at £29.99 a month, you can go to your doctor and request to receive a prescription. And I think Carolyn Harris MP has done a brilliant job campaigning to get NHS prescription fees reduced to £1 for the year. And my understanding from the latest information is that that should be available from spring on, so from April or May. So fingers crossed. And again, that because it is ridiculous that women are charged so much, 2 prescriptions, and especially with the shortages of HRT that have been there, getting prescriptions for shorter periods of times. But hopefully we'll have some better news on that in the new year. Then some very interesting questions, I suppose, around taboos, and one here. Thank you, Penelope. How do we undo the legacy of never having spoken about the menopause?
You go, Manisha.
Like I think we've said, we have to somehow break the barrier and start somewhere talking about it. And it is like we've said, it is like going on it slowly, keeping at it, and it is getting better. I mean, this is for after a long time that women are in general talking so much more about it. So we've seen this spurt. We just have to keep at it and keep going on with it. Yes, and we need to make sure that we change it for the next generation, definitely. And I think we will, because I think our generation has suffered because we've really not had that conversations with our mother's generation. But we have to be mindful that we normalize it for the next generation, and they're prepared. And as Tonye was mentioning before, it is about education and including it in the, curriculum kind of thing, because nobody does talk. People are actually caught unaware that menopause can happen. They're just caught unaware. So we need to make sure that the next generation is better equipped. I don't know if that answered the question.
I think so. I think it's doing what we're doing. Tanya, any thoughts from you on that?
No, I agree completely. It's continuing to talk about it and continuing to talk about it, and then to try and remove the barriers for women accessing care and treatment. It seems very daunting, but I think, we will, the more we talk about it, the more we normalize it, the more we open it up and have more to discuss. So, well done, Helen and Mel.
Sometimes your friend is waiting for you to start the conversation, so be the one to break that, and break into that conversation.
Wonderful. That's so inspiring to hear you both talk, and really appreciate you taking the time here tonight. So I think there's still a few questions left in the chat. Emma and I will go through them, and we'll send links through to relevant resources on the website. There is one last one that I think I would like you, Tanya and Manisha, to reflect on. It's from Alexis, thank you. The high profile, often wealthy white female celebrities talking about menopause have a certain look and resources to help them cope with menopause. Do you think there's a danger menopause is becoming a class issue?
Yes, it can be seen as a white woman's problem, certainly, or a white middle class woman's problem. And it affects everyone, doesn't matter, socioeconomic background, where you're from. And again, it's back to what we were saying. We need to be intentional about it. We need to normalize this conversation. We need to support women to access help. And empower them to take control, essentially. There is the danger, and it's portraying the nuances of the menopause, the sort of freedom that comes with the menopause, as well as preparing women for the symptoms they may or may not experience. So it is about not just it's not having that one narrative about the menopause. It's having a full, complete story about the menopause.
And building the confidence to actually, go for your treatment, ask for your treatment. And again, it comes back to having access to something like a questionnaire, which has been put in the link, so that you're prepared. You prepare yourself well before you see the clinician, so that it is not because you lack the confidence, because you lack the ability to have a conversation properly in English, that you will be disadvantaged. Be prepared before you actually go for your appointment.
And for some women, actually, all they want is the conversation.
Yeah.
And
yeah.
that's
to be heard.
Yes, absolutely, to be heard.
Yeah.
Brilliant. So I think that is a lovely way to conclude. This is about an inclusive conversation. So I think I'd frame it maybe a little bit differently. I think it's brilliant that these women have started the conversation, and it's an and it can't stop there. We need every woman to be involved in the conversation. Hence the importance of having Tanya and Manisha speak about this tonight. As we prepared for this call, we spoke about the fact that you cannot be what you cannot see. So having all women visible in the conversation about menopause, to be there as role models, to be there as friends, and to encourage the conversation is so important. So Tanya and Manisha, thank you so much. You've had very busy days in the clinic, so really appreciate you taking the time out this evening to have this really important conversation. As I said, we'll put all of the unanswered questions, we'll put links in the email that will go out, and apologies for those that we didn't get to. And again, apologies, it's my incompetence in something in the setup for the Zoom webinar of the chat not working. We'll get it right for the next one, but I'm sure we'll come back to have more conversations around this, because I think what we can all safely conclude from this evening is that it's just about keep having the conversation. So thank you very much. And Mel, back to you.
Well, thank you so much to all of you, as Helen said, for an incredibly interesting and informative event. It feels like there's so much more we could cover here. Once again, as Helen's mentioned, there's a reminder that this event was recorded, and a link will be mailed to everyone who registered this evening, along with all the links to other resources. And it will also be available to view on the Restless YouTube channel, as well as within our menopause section. If you haven't seen our previous menopause events, you can find them there too. And also a quick reminder that we've got another event coming up on October the 20th. So hopefully you'll sign up for that event as well. And thank you very much to our partners, My Menopause Centre, to the amazing panel, and of course to all our members and everyone else for joining, and for all the fantastic questions and comments. Enjoy the rest of your evenings, and good night, everyone.